I think that virtual reality is going to blow up in the healthcare space. I think there is a ton of potential.
Welcome back to the CYUTIL podcast. My name is Colin, and with me, as always, is Chauncey Friend, the founder of CYUTIL.
I'm here, man. We're back after a couple months of doing great things.
Absolutely. You see, that's the best part about this podcast. You don't know when you're going to get it, but when you do get it, amazing things will happen.
You betcha. And today's amazing things come from a couple of guests that we brought on today.
I'm super excited because who's joining us? They're some of your collaborators, right, Chauncey?
That's right. So at my day job at Indiana University, I've worked in collaboration with a graduate student named Wen Krogg, and her client, which is actually just more, I guess, her specific collaborator for their research project. His name is Dr. Dmitriy Golovyan from Eskenazi Health and IUPUI Health and Regenstrief Institute. And Colin and I and Wen actually all are alumni from the School of Informatics.
Yeah. See, that's the best part about our field is that it has a lot of different, you can spread in many different ways with technology and education and entertainment. Like there's so many different worlds involved with the new media.
We just all have these like really interesting cutting edge toolboxes of, digital capabilities. And as we're going to discuss today, you can be an entertainer, you could help people, you could, carve out a niche for yourself. It's just really awesome. And I'm happy to talk with them today. So I guess let's get started.
Awesome. Can't wait to meet them. So just recently, Chauncey sent me a link to a news article that had the PsyPipes involved, and it had something to do with healthcare. Can you talk a little bit about that, Chauncey?
Right. So
what it was?
I shared you a link that was a local Indianapolis news spot on, I think it was Wish TV, and they were covering Wen and Dmitry's project over at Eskenazi Health. So at some point, Wen came to me as a student and said, I'm doing this therapy-based virtual reality thing. I need some help compiling. I think you were looking for compiling on the Gear VR headset.
Right.
And I was like, okay, let's just do that. And then after I realized that you and Dmitry were just really trying to work on building virtual reality for critical care patients, and you didn't have the requirement of just like a Gear VR headset, but just let's try to do VR with critical care. I was like, well, let's take a step back and let's talk. And we actually designed a whole rig together and took it over and spent late nights together. And and Colin, what you saw there was the news coverage of it. So it was a really unique project, and that's why I asked him to come today and talk about it.
Cool. Well, that gets us into the first thing I would like to talk about is could you give the listeners a little overview of the starting to use VR in the Eskenazi Health Critical Care Center? Right.
So Dmitry, the question, and for the listeners, Dmitry can't quite hear Colin as well as we can, so I'm going to relay some questions. But Dmitry, the early question is why exactly would it be beneficial to use VR in the critical care unit over Eskenazi Health?
So it's not only at Eskenazi. We are gonna be using this in University Hospital and at Methodist as well, and at Eskenazi.
Great.
Can you hear me okay?
Yes, we can hear you.
So we're going to be using it throughout the IU hospital system, including Eskenazi and at Methodist. And I'm actually leaving University Hospital right now, where I just enrolled a patient into my study at in the University Hospital ICU. And she actually was an Old Order Mennonite, sorry. She was an Old Order Mennonite, and she's never been to the beach before, and the VR content is a beach scene. And she was, I had a undergraduate student that's helping us with the research project over the summer. She was there her first day today. It was the first time she saw it. And the undergrad student was almost tearful seeing this woman's reaction when she put the goggles on.
Oh, wow. Thank you so much, by the way, for calling us on your way home. Yeah, I know you go through a pretty busy day and you do some amazing stuff every day.
Yeah, I really wanted to be there in person. It's just that my wife is leaving today, and I have to get home to do childcare responsibilities.
No worries, and thank you again. So, you said the woman that you worked with at
He's
IU
an
Health.
old order Mennonite, so it was a very different experience for her.
Was she a patient?
She was a patient.
Okay. Wow.
And she's never tried she obviously had never tried VR in the past. But the reason that we do this, the background to this is I am a critical care doctor. And so we provide life support to critically ill patients. And critical illness means that most patients in my intensive care unit are in some form of life support or multiple forms of life support. So life support, including breathing machines that require breathing tubes as thick as your thumb going past into your throat, past the gag reflex, past the cough reflex, through the larynx. They require very large bore intravenous lines, some as thick as a pencil or actually even thicker than a pencil, inserted into the neck or the chest. Real-time dialysis, and that's not to mention whatever disease process got bad enough that they required life support. So all of these things are very unpleasant. Many of them are very painful. And so patients require continuous infusions of pain medications, including opiates or sedatives, to what on TV is referred to as a medically induced coma. So most of my patients are in some kind of a medically induced coma, although I think that medically induced coma is a little bit of an exaggeration, or more of a layman's term. But they're really just getting sedation so that they can be calm enough that they can tolerate the invasive things that I do to them,
right,
to keep them alive.
So most of this stuff sounds like you're really just trying to keep people alive and get stabilized.
So what we do in the critical care setting is we keep people alive long enough so that they can recover from whatever life-threatening disease process got them that sick in the first place. So we keep people alive, and while we're keeping them alive, we treat whatever disease made them really sick that would have otherwise killed them before they get a chance to get better. So this is a really, it's hard to romanticize what we do. We do very invasive, very unpleasant things to people to keep them alive. And the most common memory that patients have of their intensive care unit stay is pain. And a lot of the pain and anxiety and the medications, even that we use to treat pain and anxiety, cause something called ICU delirium. And ICU delirium is a sudden onset, very severe confusion that happens where patients become disoriented, oftentimes become agitated. And when they become agitated, they start tugging at their life support equipment, and there's a threat of pulling it out by accident, which could potentially be catastrophic and life-threatening. And so oftentimes they have to be in restraints while this happens. And the restraints don't help agitation, as you can imagine. Restraints just make it worse. And so ICU delirium is a really bad complication of critical illness. And a lot of the risk factors for it, such as pain, anxiety, and medications to use to treat pain and anxiety, they are all risk factors to make it worse. And so what's really needed, what I realized is needed, is some kind of a non-pharmacologic intervention that could reduce pain, reduce anxiety, and meanwhile reduce the cumulative dosages of medications that we treat pain and anxiety. And I thought of virtual reality. And the other benefit to virtual reality is that the content is only limited by your imagination. When you're working with people like Wendy and Chauncey, really the content is just limited by imagination, and we can think of anything. And not only can we limit people's pain, but we can also replace their view of the ceiling tiles in their room that they just look at 24 hours a day with something that's more cognitively stimulating and provide a sort of life support for the mind, which is often very adversely affected in critical illness. And actually today, the woman that we enrolled in the study today, when I used this line, they said, we're going to replace, my goal is to replace your view of the ceiling tiles with something better. The sentence that she said to me, because she was not intubated and she could talk, the line that she used is, I can tell you exactly how many dots are on those ceiling tiles, is what she said. It was,
wow.
I got shivers when I heard that.
Man, that's intense. It's an intense experience to be accompanied by ceiling tiles, right? So virtual reality, using creativity and a little bit of escapist design, that was what inspired me when I heard what you guys were doing. So Wen is actually very creative in modeling virtual objects and scenes. And when I first saw the project, you were using like nature scenes. Is that so specifically, like, was that just kind of an intuitive thought, is if we're going to make people sort of escape these ceiling tiles, should it be nature?
To be honest, Dmitry and I talked about that before I even began working on any of the designs. And our goal was to find places that people like to travel, the ocean. What makes people relaxed? The woods, by a lake. So those were...
Yeah, it seems very reasonable. Yeah.
You guys are talking about the different environments and stuff like that. What improvements were you seeing in the patients when they were using the VR?
So, Dmitry, the question is, what specific improvements do you sort of hypothesize will happen and what you've already seen?
So what I hypothesize will happen is the VR will work partially as a distraction therapy to distract them from the discomfort of their environment. And by doing that, it will reduce their pain and reduce their anxiety and reduce the dosages of medications that we give them. So what's been shown in past clinical studies of virtual reality is that patients that control their own pain medications by pressing a button every time they feel pain have had less button presses, so they've had less need for these medications. And really also very importantly, this study has never been done in the intensive care unit. Nobody's ever put VR goggles on critically ill patients before. And so the most basic design of my study is that we can do it in the intensive care unit. We can do it safely. We can do it without interfering with all the complex gizmos and pieces of equipment that we already have in there. That our nurses can make time to put these on patients without taking that time away from all their other responsibilities, and that patients find it useful and enjoyable, and give us whatever kind of feedback they can after they get better to make us to help us improve the product.
Well, that goes into how are you designing these worlds for the ICU patients?
Right. So Wen is essentially the only one building content for this project so far, and she's been doing quite a lot of intensive work in Maya. And you want to speak a little bit about your design and what you've done there?
So
I just want to say I contributed by doodling a few things in a napkin once.
He did. Actually, I redid my design several times when he would see it, and then he would scribble on a napkin during coffee time. No, let's do this. And it actually always worked out better that way. But we start building, we get the concept first. So we decided to go with an ocean scene and a lake scene. And then basically all you do is figure out if you were in the woods by a lake, what would be there? What would you see? So you just try to make it as realistic as possible. A bench, trees, a gazebo, anything that would make the VR experience more realistic.
Awesome. And when you put the headset on and you see these things at scale, and you've never seen VR before, especially if you're in a hospital bed where you're just constantly agonized. I just imagine when you showed me, I was like, well, this is perfect. This is what I would want to see if I was stuck in the hospital bed. And the content, you had some interaction things built in, like if you weren't with it, like if a patient wasn't with it, and they couldn't use a controller, what kind of things did you strategize around that?
So understanding the limitations of what each of the critical care patients needed or had was very important, because many of them, as Dmitry had said, are shackled. They can't move their hands. They have like maybe their finger or their thumb able to move. They've got breathing apparatuses on them, so they can't turn their head very well. So we had to design features in the program that would allow for the patient to be able to move within the scene with that limited mobility.
When Chauncey helped you guys, he added the heat and the wind to the device. Do you see envisioning other ways to expand this project?
So the question, Dmitry, was when I added wind and heat, we were just essentially like expanding the rig to make it somewhat more immersive. In terms of making the rig or just the experience more exciting, engaging, less stimulating, more stimulating, what is your thoughts on like the content creation and like how immersive the rig is moving forward from like more of a VR standpoint? Because a lot of folks that listen to this podcast actually are coming from it from the VR angle, the technology angle.
So it's hard to say what effect. It's hard to quantify the effect of air movement on the skin and the sensation of warmth on that the patients will. That it's hard to quantify the effect that these things will have on the patient.
Absolutely.
Because in a VR system, and I'm not a VR expert. I'm just developing a very narrow expertise in VR. But I'm by no means a VR expert, and it's hard to quantify the really the sense of presence that you have in the environment. Although, actually, there's a lot of sense of presence surveys, and there's a lot of validated tools to assess the sense of presence in the VR environment. I'm just gonna start it over. Actually, I'm gonna start it over because my answer doesn't make sense to me. But
that's fine.
Can you ask me the question again?
Yeah. So I guess let me simplify my question. So if since you're not a tech VR person, but you are looking at this sort of on the ground in the field, and you've seen a range of VR tech, from your perspective, how can the rig change to be of a better service for you?
So I'll start by commenting on the elements of the rig that are beyond just visual virtual reality. So we have the fan that Chauncey made that creates the sensation of air movement on skin. I did not know what to think of that the first time I tried it. I thought, how much more can a little bit of fan add? I honestly, I thought maybe it would be, I didn't know if it would take away or be unnoticeable, but it's just having that element be turned on and off. It gives me a great sensation in the. You can sense a great difference in the sense of presence inside the environment.
Yeah, I remember sitting you down with the rig, and you were kind of skeptical. You're like, this is such a lot of equipment to take over there. And then we tried it with and without wind, and you're like, well.
And then Chauncey's demo is you're on a hot air balloon moving moving over a mountain, and then it feels incredibly realistic. And then the wind turns off, and it still is immersive, but it starts to all of a sudden feel like much more of a video game. It took away when the wind on. It added, not in a bad way, but it really added almost to my element of fear, because I'm a little afraid of heights. And now I was moving in this hot air balloon, and there's wind blowing in my face. And when the wind blows off, you kind of get this. It reminds you that you're actually in a video game environment, and then it turns back on, and it's hard to remind yourself of that when you're in a video game, when you're moving and there's a cloud and there's wind that's blowing in your face. It's just incredibly more immersive. There are standardized sense of presence surveys that have been validated in virtual reality research. And a lot of the tools that we use for hospitalized patients, when we put these VR goggles on them, a lot of the tools that we use actually incorporate elements from validated sense of presence surveys so that we can extrapolate this information. And we will have this data for different rigs that we use, because some of our goggles that we use are basic gear VR goggles where we don't have wind, we don't have controllers, we just have a static environment where patients can look around and sense that they're at the beach. And we have others where we can just turn the wind on and off. I'll tell you, actually, one of the patients, this was not a patient, so we do a 360 evaluation. This was actually a doctor that tried this, because we want to get doctors and nurses' perspectives. And there was a doctor that tried this, and he was using the beach scene using Gear VR, and he had never used virtual reality before. And he said, to be honest, the only thing that makes it feel unreal is every time that door to this room opens, I feel a cold draft enter the room. And it's weird to feel this cold when I'm sitting at the beach.
Yeah, I've
I
said
think
many
there's
times.
your answer right there.
No, thank you. Virtual reality to me it's got to be an illusion for your whole body if you're going to make it experiential. And I appreciate you and when working down the path of the research side of things, because what you're doing is going to potentially have a lot of positive implications on other areas of healthcare and therapy with VR if you publish your results later on. And I know you guys are working towards that. And
yeah,
if all of a sudden you guys measure some sort of quantifiable improvement on, less medicine they're using, less risk factors, I mean, this could be just huge. So that's why I really wanted you guys to be on the podcast today to bring that to light.
I think that virtual reality is going to blow up in the healthcare space. I think there is a ton of potential. The problem that I've seen so far is a lot of the companies approaching this are approaching it from the perspective of for-profit companies, and they're doing research, but it's internal, unpublished research, and a lot of these companies are not made of they don't employ real clinical researchers. They employ content creators and people with ideas and skills to execute them, but not so much people that A, understand medicine, and B, more importantly, understand the research component of things.
Right. So VR could, as far as markets of VR happening in the healthcare industry, it's probably going to spring out of university research, I would imagine.
Well, right now it's springing out of private companies, but it's being marketed the way the private companies that I've seen do this so far, there is a propensity to market this the way the private companies know how to market, and that's by showing the product to doctors and saying, hey, look how cool this is. This must be helpful.
Right.
But that's not how most doctors think. The people that hold the purse strings in the hospitals think, because they're going to want to say, give me the quantifiable benefit. And the quantifiable benefit that they look for is going to be published in a journal like New England Journal of Medicine. Mm-hmm. Or the American Thoracic Society journals, and they're going to want peer-reviewed research that has withstood rigorous criticism and has been proven beneficial. Otherwise, the healthcare environment is already, things are very expensive, and it's unfortunately is an environment where everybody is trying to cut costs and not expand costs, and things are going to need to be proven beneficial in order for the healthcare space to invest in it on a large basis.
So I'm going to take this for a second, Colin. So Wen and I have talked many times about therapy-based VR, maybe not even specific to this project. So as a creator, what excites you about building virtual worlds to help people relax or be, in meditative states, or however you might see that? I guess I kind of want to know how you perceive VR being used in somewhat of a relaxation or therapy-based scenario.
Well, to be honest, the first thing that you think about when you're in a media arts school is, what do I need to do to get a job? And so most of the students there want to get jobs in the fields that they enjoy, which is gaming, movies, But somebody had brought up once in a class that we could use our skills towards the medical profession, towards helping people. And it was something that touched me at that time, and I didn't know how to get involved in it. But after talking to one of my professors, he had suggested that I speak to a doctor over at Eskenazi, which was Dmitriy, and learning what he wanted to do and what the patients have to suffer in the ICU, it touched me. So I got on board real quick, and I wanted to help any way that I could. And it was funny because I had spoken to one of my friends about my project, and she was just flabbergasted about it. She was amazed, and she had told me a story. Her son had liver or kidney failure, and he had to spend a lot of time in the hospital. And she's like, that would have been so amazing for him to have something like that to do while he was waiting. And so it was a lot of those little experiences that really got me on board to working with my skills in that type of a profession rather than going to gaming and whatnot.
Isn't that funny how we start out, we want to become Steven Spielberg, we want to be the next video game designer that's on, like a rock star. And we find that you can all of a sudden take these skill sets and help people, and it feels a little bit bigger than
Right.
becoming Steven Spielberg. I mean, not to diminish Steven Spielberg, but
it feels more worthwhile.
yeah, right. And you were telling me a bit about your father. You'd been sort of through some tough things with your father, so this is also kind of intrinsically inspiring to you.
True. It's actually kind of funny because it wasn't until last year that I learned that my father had no recollection of his experience in the ICU. So when I first started this project and I heard about everything that had happened, he was in a motorcycle accident when I was like 7. And so when I got to the hospital, they weren't very good at keeping us out of the room. So I got to see everything. And it was very traumatic. They had said that he wouldn't, if he did wake up, he would probably be a vegetable. And then miraculously, his brain cells started regenerating at like an faster rate than normal, I guess. And so he was perfectly fine after several surgeries. And he had wonderful doctors. But until last year, I thought that he experienced all those things that people did while they were in the ICU, and it's horrifying. So to be able to lend and help people in that situation, it means a lot.
Yeah. I'm going to do a podcast with Colin here in a couple weeks where I'm going to share a story about I took the pipes rig with the hot air balloon up to a senior citizens home, and like where my grandma's at. And these are like 80 to 90-year-olds. It was a woman over 100 years old. Oh. And like I thought I'd have like a couple people try it, and it was like a huge deal for them because it broke up the monotony of just being in a retirement home. And their generation do not use computers or play video games, so they're not going after content. They'll go on like bus trips and stuff, but their bodies can't take them there. Where VR is so much more portable. I figured by the time like your and I generation is actually in nursing homes, we'll probably have a lot of nice portable experiences, and we'll want that.
We might actually live longer too because of it. Because I'm a firm believer that once somebody who is older gets put into a home or a retirement, they lose a lot of their mental capacity, their functionings, and when you lose that, then your body starts to deteriorate too. So I feel like I wish that was available for my grandmother when she was in the nursing home.
Absolutely, yeah. Dementia and Alzheimer's are just awful diseases, and if virtual reality has a part to play, I mean, bring it on. That's what I say.
Right.
So we're working with a company called Mind VR with a Y out of Texas, and that is actually what what they want to focus on. They want to reach all these people who are in nursing homes and adult daycare centers, and they're creating content that they can relate to. That they're creating a lot of content that they think elderly people will have an easy time relating to, and they do relate easily to it, like oldies concerts. But then what they're also finding is they have all these action adventure pieces of content, and people skydiving out of airplanes landing on aircraft carriers, roller coasters. And so jumping out of an airplane is not what you would expect the 90-year-old at the nursing home to enjoy doing. And what they're finding is that's the stuff that they want. It's all these things on it's not even life necessarily things that people put on their bucket list to do over a lifetime. It's just when you have people who no longer have complete control over their lives, like we do, who are sick or who are elderly, then taking them out of their day-to-day experience that they have no control over, and then giving them options of what do you want to do next. Yeah, you're stuck in this wheelchair. Yes, you're stuck connected to an IV or in a hospital bed, but do you want to go jumping out of an airplane today? Or do you want to go to a beach in the Caribbean today? That it gives people, in many ways, it gives people control over the next small phase of their life, and it has entertainment value, but I believe that there is a therapy value to it as well. And there's a lot of people competing to be the next Steven Spielberg and provide entertainment to healthy movie-going adult population. But there's a big neglected. There are millions of people who are neglected by the entertainment industry, and who are going through really difficult times of their lives that most of us prefer not to think about.
Yeah, the first lady that got in line to try out the hot air balloon, she said, she's like, I love roller coasters. She just kept repeating that. And I put her in and she tried it. Let's go again. And she wanted to do it again. And yeah, you're absolutely right when you said that the entertainment industry is ignoring a lot of people.
And there are so many considerations. Healthcare is not an easy industry to create this for. And what Wendy's been working on this for a year, but what she's developed over a year is she's developed a niche in not only understanding modeling, but understanding the considerations of how do you model something for somebody that has very limited control. How do you model something for somebody who can't move their arms, who can't move their heads, who can't tell you that they're nauseous? How do you determine what kind of controls they can use and they can use conveniently? And that's the skill set that she's been developing over the past year, and I think it's a very unique skill set. I know it's a very unique skill set. I'm guessing there's maybe
no doubt
people graduating every year from university that have this. It's probably 100 people over the country that know what it takes to do this.
Mm-hmm.
And she's one of them.
Yep.
Or becoming one of them.
Well, it's like you guys are saying, it's not just entertainment that you guys are providing. It's you guys are creating experiences for these people that when they're in the ICU, it could be a very negative thing to them being there, and you're taking that negative and turning it into a positive for them in a way, or at least letting them escape into a positive realm so they can heal.
It's almost like we built little theme park experiences for them. Yeah.
Yeah, they go in with the injury and they leave with a park experience. You know, that's pretty awesome. And that kind of goes into what you guys are thinking towards the future of this project. Like, what are things that you're seeing as a result from kind of the positive or negative that you guys are seeing in this? I mean, it would be kind of nice to hear if you guys are seeing any negatives, like where those are at to improve it for the next project or where it's going to.
When do you want to take the future of the project?
Well, right now, because we don't have. Before we do too much changing, we need to see what the test studies conclude. But one thing that I have been told that I'm working on right now is the realism. There are elements of the VR experience that aren't as realistic as they need to be. And the end goal would be to make it as photorealistic as you could get with a video camera. So that's what I've been working on right now, and making it portable so that it's just your headgear.
I could see that. If someone's never experienced VR before and they go in and they're like, oh, this is a forest, but that looks cartoony, it's a distraction. But if you make it photorealistic, they might, especially if they're in a delirious state, might just kind of check out of reality and just be like, I'm in a forest.
Right.
And from my perspective, I think the future is only limited by the imagination, and mind can run wild. But I think that the most important thing for us right now is to focus on the science and focus on the present, which is all the challenges that come with doing proper, difficult research and what we have right now. It takes I need to enroll about close to 200 patients in my current study, or 200 subjects in my current study, and today it took me an hour and a half to enroll one.
Wow.
And so science is hard and time consuming, and so that's I think what we have to focus on right now.
Well, we certainly appreciate you doing the academic research part of it, and that data is probably going to be the most valuable part of all of this
Absolutely.
Going forward.
So you mentioned the Thoracic Society earlier. We were wondering, the work received at the recent American Thoracic Society conference, what was that?
Right. So Wen and Dmitry presented a poster, and did you give a talk?
It was more set up where people would just walk by and ask questions.
So how was it received there? Did you talk to anybody out there that's kind of on the same wavelength?
Oh, there were a lot of people that were very interested, and from all over the country.
From all over the world. There was people.
Right.
We spent time talking to people from Australia and from Europe who all want to collaborate with us.
Wow.
It was very positive.
American Thoracic Society has actually some grants that we're gonna apply for to see if we can get some more help with the research. And really, we've been incredibly fortunate, because this is not actually an inexpensive. It's not an inexpensive endeavor to make all this, and I have been really fortunate to find Wendy and Chauncey, who have provided a lot of hours of help, and Chauncey with a lot of equipment support for this as well. And a lot of support from Eskenazi and from Regenstrief from Indiana University and the School of Media and Arts and Informatics.
Yeah. Thanks again just for opening up and explaining the project to me. So many researchers are kind of keep that stuff really kind of close to the chest because they're worried people steal ideas, but I think you recognize there's a lot of work to do.
Yeah, and it kind of seems, just from my end, hearing about just the ICU part about it, I never saw VR going there, and so it's awesome seeing where you can take this technology and just advance it in even a medical way, and that it's actually and I'm also wondering, what other type of VR therapy do you see helping others with this?
Right. So other types of VR therapy, we kind of hit on some others already, just in conversation with folks that are in retirement homes, but then also I would think that just perfectly healthy people that meditate probably are going to look into VR. There's already some meditation apps on the Vive right now
To help with stress and depression.
Yeah, there you go.
Guys, there is data coming out for post-traumatic stress. There's data coming out for depression. There's data coming out for anxiety disorders, for fear of flying, fears of specific phobias. There are people researching chronic pain and we have an opioid epidemic in this country that's being largely driven by people in my profession over prescribing pain medications. And now we're looking at using VR for not just for acute pain in the ICU, but for patients experiencing chronic pain at home. I think the sky is the limit, and I think that this is one of these things where if we replay this podcast 5 years from now, we're gonna I think it's going to be comical how little we actually imagine, because there's a lot of smart people all over the country that are going to get into this and start working on this stuff. And I'm convinced this space is going to explode.
That's what I love. That it kind of seems like you guys are at the forefront of this. Like it's kind of the frontier of VR right now. And
yeah, absolutely. I mean, Dmitriy said he's probably, him and Wen are probably the first ones to put VR headsets on critical care patients ever in human history.
And here it is, the start of it. And it's just going to get bigger. It's just going to get bigger and bigger.
Somebody might write me an email saying, no, I did that back in 1980 something.
It's probably going to be Albert.
Right.
I'll say, well, you didn't have Unity back then. It didn't look that nice.
Right.
Anyway, well, thank you guys for joining us. I don't want to take up any more of your time, but do you have any concluding thoughts that you'd like to add? No? Okay.
Thank you for having us, and really thank you both so much for all your work.
Oh, you're welcome. And I'll make sure I give you links, and I don't know, copy Regenstrief on there and whoever else that you deem appropriate. So thank you.
It was good to talk to you again, Dmitry. Thank you for having me.
Bye.
You're welcome. See you, Dmitry.
Chauncey, that was amazing. Thank you for bringing those collaborators to the podcast.
Oh, thank you, man. This was a lot of fun, and I think they had a little bit of fun too. But yeah, Dmitry and Wen are the real deal. They're doing some real work in virtual reality, and I'll tell you, when I first had Wen walk in the lab, I was like, I sort of helped her just like I would help any other student, just to help her solve her technical problems she was asking about. And then as time went on, it became apparent that like there was something happening in her project that was like a very good use of virtual reality. It was like, it became apparent to me after speaking with her a little bit more, in Dmitry, and they kind of gave me more background. So like Dmitry said, he and I were in this lab that I'm in right now. If you're watching on the video on YouTube, by the way, this is at Indiana University's Advanced Visualization Lab in Indianapolis.
Whoop, whoop.
He and I were in here till like, I don't know, probably 3 or 4 in the morning. His wife's calling him and, "Are you okay?" "Yeah, I'm okay." And I'm texting my wife, and we were building quite the rig. He is somewhat of an artist as well as a doctor. He built this amazing like plexiglass labeling on the front, and he used spray paint art on the front to actually make like this like curvature. I'll edit some pictures into the video on YouTube, on CYUTIL's YouTube page, and I helped him put like a VR-ready laptop on. We attached some fans with a SciPipes unit and some networking gear and a monitor. And man, it looked like a hospital-grade piece of gear that we just like built over the course of 2 nights.
Wow.
And Eskenazi Health is the critical care place that we demonstrated this, and that place is amazing. Like the donors for that place really emphasize the architecture and the artwork, and it looks like, I don't know, like a modern art hospital. That's the best way I can describe it.
The news clip that you sent me was really inspiring in that way of like what they're trying to achieve and stuff like that. And actually, do you know how long of a span of time from start to finish to get to that point was that for them?
Well, let's see here. So Wen, I think, approached me around March of 2018 this year, and then we presented at Eskenazi Health right at the end of May. So March, April, May. So like,
wow, that's quick. That's really quick.
3 months.
In a lot of ways.
Probably like 2.5 month turnaround. Yeah.
Wow, that's quick. That's really cool. Advancement in technology going that fast.
Yeah,
you know?
She had. Well, it was like a meeting of the folks, right? The meeting of the technologists, because I was working obviously on pipes a lot, and I had demonstrations here. And I remember Dmitriy coming to the lab and sitting down and doing the hot air balloon rig, and it's like, wow, yeah, that's really immersive. And then at some point in the conversation, he realized that I built it.
Oh, wow.
He goes, wait a second, this is yours? And I go, yeah, this is what I do. And that's when I suggested to him, hey, would you be open to adding some wind and heat? Because Wen's already built a beach environment and this nature environment. I could just add a couple things. And he's like, his willingness to let me do that, I really appreciate, because, most doctors, and even him at first, he was a little skeptical, like why add extra gear? We haven't even proven VR yet, And he also mentioned that hospitals sometimes have a problem with using fans because it circulates maybe germs around or something. And but he, this is why I like certain collaborators like this, because he just said, let's just try it, and the opportunity was there, and I just made sure I gave him everything I had as far as time and equipment and work, and man, was that a fun project.
I mean that's really interesting, because it starts out where they're just trying to gauge where VR is with the medical field, and then on top of it, the pipes is such a unique invention to put on top of there that will add even more to what they're trying to gain, because it's not just visual, it's actually touch, feel, smell, like all that stuff. And pipes is associated with that in a lot of ways.
I'll tell you, I learned from this project. I learned, sorry to interrupt you there, Colin.
No, I want to hear this. Yeah, this is
I
great.
learned that, like, the best reason, I guess, to go towards environmental feedback, like wind, smell, heat, anything like that, was using pipes, is like, if realism is a priority, and like you heard Wen mention, I want more realism. She was saying that early on. Yeah. And like most like doctors might say, like, well, not doctors, like I guess like researchers might say, well, what's the point of realism when you haven't even proven that VR is useful yet? Well, if you step back from the technology and you think about a patient who's all they know is they're in an environment and they're in pain, okay? And they want to not be in pain and not be in that environment, okay? So if you present them into a more realistic environment that's soothing, that is like a pretty fundamental thing. And my point is that I learned that environmental feedback works not necessarily for like cartoonish type virtual environments. Like it works for that, but like it really works when you're going for realism, right? Because your users typically, if you're going for realism, if it's not like an entertainment based thing, it might be their first time experiencing VR, and it's like, what is this thing you're going to do to me? And when they put the headset on, they expect, if they see leaves blowing in the trees, that they would feel the wind. It should just be there. Like some of the best effects ever done in any sort of art medium are things that just your body and your brain expects to be there. And it's a corroboration of the sensations that your body feels in your eyesight and just your sensory system, all just kind of like in a new environment. It has nothing to do with the technology. It has more to do with, okay, now I'm in this environment. Like that sensation or that. Yeah.
Yeah. And making it more realistic, it helps that transition. Even if it has the uncanny valley in it and stuff, it helps a lot more to be more realistic, because it'll help you connect to that environment that you're putting them into.
Right, and people are pushing realism, and I can't wait to learn more about how they're doing it. There's an artist I'll point our listeners to called Rens, R-E-N-S. If you look up Ren's artwork on YouTube, he uses Unreal and just does these amazing workflows where he'll do a photography study out in the woods, and then he'll come back and replicate that environment in VR, creating the assets, creating the foliage, and it's literal photorealism. So check that out.
Awesome. And I would like to end with that. I feel lucky to get to see the advancement of technology right here, right now. It's happening. SciPipes.
I'm really happy to share it with you, Colin, because you have a very unique enthusiasm of all the people I know. And yeah, if there's anybody I want to like bring good news to about a new tech development, it's you.
That's awesome. Hey, I love it. I enjoy every moment of it. But I wanted to hear, you said that you had something you want to tell our audience. Right.
So for those of you out there who know about SciPipes, and those of you who don't, I guess I'll give you a quick rundown. It's a control system for virtual reality developers where you can connect up items to outlets. So like think of a power strip that has a computer inside that listens to Unity or Unreal. And actually I have Unity support fully supported now for beta testing, and that's what I'm releasing is a batch 1 of manufacturing. I've made 20 different SciPipes units that all have unique names and serial numbers, and I've quality tested them, and I'm happy with them, and I'm ready to ship them out to developers. There's a few already gone, but I still have over 10 left. And if you want to get a hold of one, I'm offering for early adopters $250, which basically just helps me to break even so that I can get these in your hands and share them with you and sort of get my parts money back. But the whole point here is for you to give me feedback, and they are available. You can contact me at cfrend@CYUTIL.io, or you can contact our general info at contact@CYUTIL.io.
And we'll put stuff in the descriptions of anywhere you get this podcast and on video too. Awesome. Well, I'm really excited, and I can't wait till our next one because we're going to do one soon. And you kind of told a little bit about it earlier, but I'm excited to get to all this because all it is just advancement in the realm of VR, and it's a very exciting time.
You bet, man. And the folks at Hubbard Hill are willing to be on the podcast, and I'm excited to get up there and set up this equipment, and we'll get them in person talking
Awesome.
on the podcast.
Exciting. Well, until next time, thank you very much. Thank you for listening or watching the CYUTIL podcast. Until next time.